Hello, my name is Emma Whipple, and this is my presentation on Amish Americans. This past summer, I went to Missouri with my family, where we stopped in an Amish town. We ate at an Amish restaurant, which had so many different kinds of foods, such as bread, butter, homemade jams, gravy, and more. And it was all so delicious and left us full and happy. We saw different families and their horses and buggies. We also saw that the outfits of the Amish were different than typical American styles. Seeing these different traditions sparked my interest in the Amish American population, which is why I chose to do my presentation on the Amish Americans. The population of the Amish in the U.S. as of 2020 was 344,670 people. Most live in the Midwest, with Pennsylvania having the largest number at 81,500, and Indiana and Ohio also have a large Amish population as well. The Amish's origins go back to 1693 in Europe, when they separated from the sect of their religious leader Jacob Ammon, as well as from the Swiss Brethren leaders. The split occurred over different beliefs and lifestyles in religious practices. The first Amish group came to North America from Europe in 1737. At that time, Amish leaders encouraged their members to live close to one another to offer religious support as well as physical aid in their farming labors. This created a tight-knit community of Amish people who did not need to rely on their non-Amish neighbors as often. Throughout the centuries, the Amish continued to immigrate to the Midwest of the United States as well as Ontario, Canada. By 1900, there were very few Amish left in Europe, as most of them had already immigrated by then. By World War II, there were no Amish in Europe. Since being in the United States, the average Amish family has 5 to 6 children. The Amish typically do not leave their faith, and between these two factors, the Amish population doubles every 20 years. The Amish are not opposed to modern medical treatments, but are inclined to turn to alternative medicine first. These include folk remedies and drinking herbal teas. The Amish population are also proponents of different vitamins and homeopathic remedies. They will also visit reflexologists and chiropractors. The Amish believe that God is the ultimate healer, so they are less likely to intervene in the life cycles of the elderly. It is unlikely that they will refuse major life-saving surgeries, however. Many Amish communities also have their own clinics that specialize in genetic diseases. These diseases are typically more common among the Amish because of the culture's relatively small gene pool. Many studies show that the Amish are typically healthier than their non-Amish neighbors. This is largely due to the fact that the Amish are more physically active and they do not drive vehicles. Instead, they rely on other forms of transportation, such as walking, horses and buggies, and riding bicycles. These forms of transportation also reduce the Amish's exposure to vehicle emissions and pollution. Although the Amish tend to be healthier overall, these limited means of transportation result in more barriers when trying to visit healthcare providers and facilities. They may be limited to a smaller radius of where they can travel and may be at the mercy of certain weather conditions. Healthcare workers should keep this in mind when working with the Amish population and should consider traveling near or to the Amish community on house calls. Private insurance is virtually unheard of in an Amish community. The Amish choose to pool their funds and use a form of community financing for their form of healthcare, and most Amish people pay it into a church fund. In an Amish community in Holmes, Ohio, the Amish members pay $90 to $110 per month per member. The Amish do not practice forms of birth control. This includes abortions, even when the mother's health is in danger. This is due to their religious duty to multiply and replenish, as well as their belief that birth control is seen as taking away the life of a child of God. Interestingly, some Amish are becoming more accepting of the idea of birth control. For example, in Holmes County, Ohio, a survey was taken regarding the Amish community's perceptions towards birth control. Over 75% of the respondents strongly agreed or disagreed with birth control. However, 13% somewhat agreed with using birth control. Because of their religious beliefs, it is important for physicians and nurses to be sensitive when discussing the topic of family planning. Along with birth control, the Amish do not support prenatal care. This is due to Amish culture, customs, and cost of care. The Amish do not have health insurance, and the average number of children in a family is 5 to 6, so going to the hospital could get costly. Due to the lack of prenatal care, there is more risk of complications at birth for the Amish population. They are not, however, opposed to visiting the hospital in times of a life-saving measure. Many hospitals see Amish patients when an at-home delivery experience severe complications, even when those complications could have been prevented by the proper prenatal care. Most Amish communities have their own primary schools. Amish children, however, do not attend high school or college. The Amish do this because their communities are primarily agricultural and craftsmanship based. They believe that the best kind of learning is hands-on learning. They also believe that public schools can teach principles that are contrary to their religious beliefs. Amish children may also be exposed to technology and secular morals that would encourage them to leave the Amish community. Due to their lack of higher education, it is important to give Amish patients medical instructions clearly and simply. Interestingly, the American Amish choose to resist acculturation and assimilation of American society. They refrain from the use of most technologies and modern conveniences that they feel weaken the structure of the family. They do not believe that technology is inherently evil and will use some limited amounts. Some Amish will use batteries, electric lights, and landline telephones. Their limited use of technology makes them distinct in the eyes of a non-Amish American. The Amish prefer to maintain their cultural identity this way, and through limiting their interactions with the outside world. In conclusion, Amish Americans have a very unique culture which includes religious beliefs and their strong ties to their communities. It is important to remember the questions: what can healthcare workers do to promote the health of the Amish population? And what can we do to be more culturally sensitive to this diverse group?